Lowering eye pressure, the Lumigan versus Roclanda Showdown. Open-angle glaucoma and ocular hypertension are conditions where intraocular pressure, IOP, is higher than normal, threatening vision. Eye drops that reduce IOP are the first-line defense. In this showdown, we compare Lumigan, brand of bimatoprost, and Roclanda, called Roclatan in the US, a fixed-dose combo of latanoprost plus Netarsudil, explaining how each works, how well it lowers pressure, side effects, dosing, cost, and which patients might benefit most. Mechanism of action. The two drops work differently. Lumigan bimatoprost is a prostaglandin analog. Prostaglandin analogs act mainly by increasing the drainage of fluid out of the eye, especially via the uveoscleral outflow pathway. Bimatoprost is converted in the eye to a form that boosts outflow of aqueous humor, reducing pressure. For example, laboratory studies show bimatoprost lowers resistance in the trabecular meshwork by about 26%. Clinically, bimatoprost and other prostaglandins like latanoprost share this main effect. More fluid drain leads to lower IOP. Roclanda, latanoprost plus Netarsudil, combines two actions. The latanoprost part is another prostaglandin, working like bimatoprost to improve outflow. On top of that, Netarsudil is a Rho kinase ROC inhibitor, a different class. Netarsudil's unique action is to relax the eye's conventional drainage meshwork, trabecular meshwork, and lower the pressure needed to push fluid out. It also has secondary effects. It can reduce pressure in the episcleral veins and even slightly reduce fluid production. In short, while both drugs share the prostaglandin mechanism, increasing uveoscleral drainage, Netarsudil adds a tug at the trabecular outflow route and venous side of things. Efficacy. Clinical trials show both Lumigan and the Netarsudil latanoprost combo can dramatically lower IOP, but the combo generally drops pressure further than latanoprost alone, and thus more than a single prostaglandin alone. Lumigan monotherapy typically reduces IOP by a large percentage. In trials of bimatoprost 0.03%, average drops of about 6-8 mm, roughly 25 to 35% from baseline were seen. For example, one analysis noted an average reduction around 7.7 mm. This means from a starting IOP in the mid-20s, many patients on Lumigan drop into the high teens. In fact, bimatoprost has consistently shown strong pressure lowering. Multiple studies and meta-analyses found it often lowers IOP slightly more than other prostaglandins like latanoprost. For Roclatan, Netarsudil plus latanoprost, Phase 3 trials, the Mercury studies, found even bigger drops compared to each drug alone. In those trials, adding Netarsudil to latanoprost produced an extra 1.5 to 3 mm reduction in IOP beyond latanoprost alone. In concrete terms, patients on the combination averaged IOPs around 15 to 16 mm at follow-up, compared to about 17 to 18 mm on latanoprost alone. Notably, at 3 months, one study reported 42% of patients on the combo hit a mean pressure 15 mm, while only about 16 to 18% did so on latanoprost or Netarsudil alone. In pooled analyses, Roclanda patients had mean daytime IOP 15 to 16 mm versus 17 to 18 mm on latanoprost alone. There are no direct head-to-head trials comparing Lumigan versus the Netarsudil-latanoprost combo. The recent Mercury 3 trial compared the combo to bimatoprost timolol rather than bimatoprost alone. Thus, we rely on separate data. Prostaglandin drops like Lumigan give a strong single-agent effect, while the fixed combo can add on extra pressure reduction for those needing it. The combined drug is designed for patients not at target on a prostaglandin alone. Side effects and tolerability. Side effects of these drops are mostly well-known ocular reactions. Prostaglandin analogs, Lumigan's bimatoprost and Roclanda's latanoprost, commonly cause mild eye redness, conjunctival hyperemia, longer or thicker eyelashes, and gradual darkening of the iris color and surrounding skin. These changes come from the drug's pharmacology. For example, Lumigan's prescribing information notes pigmentation changes, iris, eyelid, lashes, and eyelash growth. In practice, redness on Lumigan 0.01% affects about 30% of patients. A higher 0.03% dose had more. Eyelash growth and iris darkening are not dangerous and can even be cosmetically welcome. They gave rise to Latisse eyelash formulation. However, the pigmentation changes tend to be permanent, and some patients dislike puffiness or deepening of the eye folds, sunken eyes seen with prostaglandins. Overall, prostaglandin side effects are usually mild to moderate, but they lead many patients to notice their eyes look a bit different. Netarsudil, by contrast, has a distinctive side effect profile. The most common issue is also redness, in fact, even higher than with prostaglandins. Clinical data report redness in over 50% of Netarsudil-treated eyes. Netarsudil can also cause conjunctival hemorrhages, tiny red blood spots on the white of the eye, and corneal verticillata, whorl-like deposits on the cornea, in up to 10 to 20% of patients. For example, Ropressa's label notes 53% hyperemia and about 20% cornea deposits or hemorrhages. In Rocklatan trials, about 59% of combo patients had some hyperemia, and 11% had conjunctival bleeding, and 15% had corneal deposits. Latanoprost's own side effects, modest pigment, lash changes, can add to this but are relatively minor compared to the big difference in redness between Netarsudil versus prostaglandin. In summary, Lumigan's typical adverse effects: eye redness, hyperemia, very common, 31% on 0.01%. Eyelash and eyelid changes, growth, darkening, and possible eyelid fat loss. Iris color darkening, permanent. Roclanda's common adverse effects: Netarsudil plus latanoprost. Hyperemia, redness, very common, 54 to 59% in trials. Subconjunctival hemorrhage, small at 11%. Corneal verticillata, deposits, tries 15%. Eyelash or pigmentation changes from the latanoprost, generally milder than with bimatoprost. These side effects affect tolerability. In practice, up to 40 to 45% of patients on a prostaglandin drop report some adverse event, and redness is often the main complaint. The higher redness rate with Netarsudil combinations can be uncomfortable. Many patients describe mild stinging or a bloodshot eye that typically fades over time. Such effects do influence real-world use. Patients bothered by redness or irritation may skip doses or switch drugs. Interestingly, in the Netarsudil versus latanoprost studies, some reported the red eye of Netarsudil tended to decrease after a month of nightly dosing. Both drugs are usually given at bedtime, in part to minimize noticing these effects during waking hours. Dosing and convenience. Both Lumigan and Roclanda are simple once-daily drops, usually one drop in the affected eyes each evening. Lumigan 0.01 to 0.3% is instilled nightly, as is Rocklatan. Netarsudil 0.2%, latanoprost 0.05%. So neither requires multiple doses per day. A convenience point: Roclanda provides 2 active ingredients in one bottle. If a patient needs both a prostaglandin and Netarsudil, using the fixed combo means only 1 dropper instead of 2 separate bottles. For example, someone already on latanoprost who adds Netarsudil could use Roclatan and simplify their regimen. By contrast, if a patient on Lumigan needs extra therapy, they would typically add a second bottle, another drug. The single-bottle combination can improve adherence for some patients by reducing the number of separate medications to juggle. Cost, availability, and approval. Lumigan, bimatoprost, is a well-established medication. In the U.S., it was originally approved in 2001 as 0.03% and later 0.01% and has patent expiration spun off generics. Generic versions of bimatoprost 0.01% were approved around 2025. In practice, generic bimatoprost drops are now widely available, making this therapy relatively inexpensive with insurance or discount programs. By contrast, the brand Lumigan without insurance can cost hundreds of dollars for a bottle, though coupons often reduce this. Roclanda, latanoprost, Netarsudil is newer. The European Medicines Agency, EMA, gave approval in January 2021. It is marketed in the U.S. as Rocklatan, FDA approval 2019. As a brand name combination, it is pricier. There are currently no generic versions of the Netarsudil-latanoprost combo. Netarsudil itself is proprietary. Without insurance, Rocklatan's cost is several $100s for a month's supply. Many insurance plans require patients to try simpler therapy first, for example, requiring failure of a prostaglandin drop before covering the combo. Regional differences apply. In Europe, Roclanda would be covered by national health systems similarly to other second-line glaucoma meds. Ideal patient profiles. Lumigan, bimatoprost monotherapy, is often used as a first-choice eye drop for open-angle glaucoma or ocular hypertension because it's very effective and simple. It suits a patient whose target IOP is modestly low and who tolerates prostaglandin side effects. Many patients starting glaucoma therapy will see significant IOP reduction on Lumigan alone. It's also useful for long-term maintenance if the drop controls pressure without intolerable side effects. The 0.01% formulation was specifically introduced to improve tolerability. Studies showed it maintains similar efficacy with less redness, improving adherence. Roclatan, is typically used for patients who need more lowering than a prostaglandin alone can provide. For example, someone already on latanoprost or bimatoprost, whose pressure remains above target, or someone starting therapy at a very high IOP, might benefit from the extra kick of adding Netarsudil. The combination is specifically indicated for patients in whom monotherapy, either a prostaglandin or Netarsudil, does not sufficiently reduce IOP. In practice, Roclanda might be favored for patients who need an extra 2 to 3 milligrams drop or a higher chance to reach mid-teens intraocular pressure, and for those who can accept a higher chance of redness. In summary, both drugs are authoritative glaucoma therapies, but fit slightly different needs. Lumigan is a proven first-line prostaglandin drop, simple, once daily, with well-known side effects. Roclanda is a newer combination option for more aggressive lowering or as a next step if a prostaglandin alone isn't enough. Deciding between them depends on how low the eye pressure must go, previous response to medications, side effect sensitivity, and cost insurance factors. Disclaimer: this article is for educational purposes only and is not intended as medical advice. Patients should consult a healthcare provider for personalized treatment decisions. All links to sources are available in the text version of this article. You can find the full article at visualfieldtest.com. Thanks for listening. To check your visual field, click the link at the bottom of this article or visit visualfieldtest.com.